everybody. It's your favorite OBGYN, Dr. Jen here. And I have my lovely friend, Dr. Irene Owusu Ntiamoah. Hi. And I'm here to interview her on the Faithful Physician series. So, with this series, it is all about understanding how physicians who are believers in Jesus Christ are either able to blend medicine and their faith together, or if they decide to keep it separate, why or why not they do that. So I'm interested in picking my dear friend's brain here and learning a little bit more about it. So Dr. Irene Ntiamoah Owusu, she did her undergraduate university at University of Ghana, and then she went into University of Ghana Medical School, and now she is in her final year of OBGYN training at Owusu Teaching Hospital, which is actually where I met her. While I was in residency, I went to Ghana to do a global health rotation, and we just hit it off.
Yeah, it was fun.
Yeah, we just hit it off. So now we've made full circle, and she's here with me. So, all right, you ready?
I am.
Okay.
Yes, I can.
So the first question that I have for you is, what does it mean to be a Christian physician?
So Christianity is a way of life. For me, it's how I eat, what I think, what I do. It should be Christ-like. So being a physician is just part of the things I do and not my way of life. So in as much as I think if I'm being a physician, it should be how Christ would do it.
Mm-hmm.
So that is how a faithful physician is to be. As a Christian, that is a physician, basically that.
So when you say how Christ would do it, for our viewers maybe that don't know much about Jesus or what he does, can you elaborate on that a little bit?
Well, for Christians, we know Christ is honest, Christ is just, Christ is trustworthy, Christ is transparent, and in a practice of medicine, it's in doing doing the right thing, always at the right time for the right person, not turning corners, not cutting corners, not messing up, because well, I know, probably you don't, but Jesus or God is quite orderly. And for a Christian who is practicing medicine, it's important that you go in that line where you are orderly, you're organized, that someone sees you and the person doesn't wonder, is this doctor a Christian or not? It shouldn't be something someone should be wondering. It should come off by your way of life, by your way of practice. Mm-hmm. So a faithful physician should be someone that I'll be wondering, I don't think he's a Christian, I think he's a pagan. No. I should see your practice and I should know that this person is a physician, or this person is what you call a faithful physician, right? Mm-hmm. Yeah. So mostly that for me.
Okay, nice. All right, so as a Christian, do you feel like it's difficult to practice medicine and continue to believe in the power of God? If so, why or why not?
Well, I'm from Ghana and Africa, and more than 80% of Ghanaians are Christians, so it's not difficult. Also, we lean on the fact that you don't mix medicine with religion too much. So it's not difficult, actually. You can do everything that you want to do as a Christian, just that you don't try to mix it too much with your practice. But it's not that difficult for me, yeah.
Okay. And when you say you try not to mix it too much with your practice,
well,
describe for us what you mean.
So,
and is it bad to mix it too much with your practice? I guess
it may not.
Was my question.
Yeah, it's not bad, but we believe that, or we have been trained that if you are a Christian, you don't go ahead and impose your religion on the patient. So if you have faith that this is going to work for the patient, you don't tell the patient it's going to work because you believe. You know, you give the patient facts of medicine and not put your religion out there so much. So you practice medicine as it should be practiced and have your faith as it should be, but you don't come out to your patient all the time and talk. And you know, and Jesus can do this even if medicine cannot, or you know, we don't do that. You just, you know, stick to medicine. And after, if you meet the patient elsewhere and you want to talk about religion, that's fine. But in our work, we don't talk about how Jesus can do this for you, especially if you have a cancer patient or something and you're just going to talk to the patient about what is going on, and then you bring the news to the patient and then you go ahead and say, so it's okay, it's fine, Christ can, you know, make this work for you. They tell us that it's not advisable. So you try to, you know, gear away from such. Although, you know, you try to do everything you can. If you want to be a Christian, do that. And you don't really know who you are, yeah.
Okay. All right. So the next question that I do have for you is, you know, give us some examples of how you were able to minister to your patients. So I understand that you do try to separate faith and medicine, but if there are instances of how you minister to your patients, give us maybe an example of one that impacted you the most.
So this was so we do housemanship. I think you probably call it internship here. But I remember during my house job, there was this patient who had sickle cell disease, and she came to the emergency room, and you know, she seemed fine, but she kept saying her saturations were 0, and she was talking. I mean, she walked in, and I was like, "What do you mean by your saturation is 0?" And she said that, "I know that I'm not breathing properly, but I am breathing normally, but the check saturation is 100.
Mm-hmm.
She says it's not 100.
Mm-hmm.
So there was another patient sitting next to her, and she was also having an acute asthma attack. So this patient suddenly cold, you call it. Yeah. So she just ceased breathing, and I mean, I was sitting at the emergency room, and then we started resuscitation, and this other patient also needed help. So we were trying to resuscitate this patient. This patient wasn't coming through, and so I just told the nurses and even the patient that was having acute asthma attack that, I mean, we should pray, you know, because I found myself, I thought she was fine, so we didn't put oxygen on because situations were fine. Mm-hmm. So I found this as a miracle because we prayed for her. We just said, you know, God should intervene because, I mean, it's a very Christian country. Mm-hmm. If you tell everybody to pray, everybody just starts, you know, praying. Oh, loud prayers, but you know, the nurses and the patient that was next to me, we all started praying. The patient had, you know, a nebulizer on, and wow, everybody was trying to pray. And I was, you know, doing chest compression, giving oxygen, and we're saying, please just, you know, come back. And in 15 minutes, she came back.
Wow. 15 minutes of chest compressions.
15
and breaths.
And breaths. And we really didn't have the defibrillator. We were calling for the defibrillator, it wasn't coming. And really, she just ceased breathing. Everything was gone. So we were doing the chest, and it was like she was coming in and going out of it. We're just going. Actually, somebody was like, we should just give up. And I was like, I have my hands tied. I don't know if she's still alive, but in that moment, I mean, there are other examples, but in that moment, I felt God strong because we didn't know if it was going to work. We're just hoping and believing.
My God. So, wow, that's crazy.
Yeah.
But it does kind of sound like you blend your faith in medicine.
Well, what I said was we advise not to do what you can when you know you're pressed. So I'm a Christian first, so every now and then it will come out. You can't really help it. Unless you're not really a Christian, then it's difficult. But usually when you're a Christian, when you are Christian, you feel like you have finished medicine now. The rest is just God should just take the lead. God should just do Him. You know.
Okay. So it sounds like you use the faith when necessary. When not necessary, you do more of medicine. Or correct me where I've misspoken.
Okay, so I pray on my own when I'm going to do any procedure or if I'm going to a clinic, whatever. But I will not pray for the patient unless, even if I'm going to pray for a patient, it's going to be a private prayer. Unless, and I pray out loud, maybe in theater, and sometimes not even loud, just, myself. Because it's not every patient that accepts such prayers from their surgeon, and you don't know who will accept a prayer, who will get offended by it. So as much as possible. But if, something is happening and you feel like when God needs to come in and I need Him strongly, that I know what the restrictions say. But usually just try to stay back as much as possible. Don't mix it too much.
All right. Well, okay, so my last question that I have for you is, for our viewers, how would you encourage them on sharing their faith and also being excellent in what they do, practicing evidence-based, science-based medicine?
Evidence-based medicine is by evidence. So you need to read, find the evidence, and practice with what the evidence is saying. As much as possible, be abreast with time, be abreast with what is new. Medicine is evolving, medicine is not static. So if you want to be excellent in your practice, you need to be abreast with the times. I was just telling Jennifer that we are not doing robotic surgery in Ghana, and we're not doing so much laparoscopic surgeries in Ghana. We just know of it. As much as we would want to, we don't have equipment here and there, but I think it's good that we know that it exists. But I will find myself somewhere I probably won't be able to practice because I don't have the skill. But you get yourself abreast with time. If I am with her and I can learn a few things here and there, it makes me a better surgeon. And so in that line, learn as much as you can, be well read. Don't just do evidence-based medicine, it's also not the best. Just be well read all around. And when it comes to what's the other one? Faith. You need to study the Bible, you need to spend time with God, and God directs, God leads. And if you have read and you believe and you pray, He will direct you exactly how to go and what to do. It may seem okay that when you're going in, you're going to say prayer loud and everything, but that is not the will of God for that occasion. So, and spending time with Him and having a good personal relationship with God, He will speak to you where you need to speak out loud, down the consequences. He will tell you, speak, and it will work. When He tells you, just say a quiet prayer and let's move, He will do that. And with spending time with Him, He leads you at all times. So He's always there with you, and that is how I think you can, practice or grow your faith with Christ and be excellent as well in your practice.
Nice.
Yeah.
All right, so I kind of have a follow-up question for you.
Okay.
Just with you talking about the restrictions within the medical system in Ghana, and I honestly think that those would be the same restrictions for the United States. I think that in the same way that people say there should be a separation of church and state, I think the same really exists for medicine, but I mix mine. And not really with the fear of, what's going to happen, am I going to lose my license, but really just being led by God. So I know what exists for, based off of what you're telling me in Ghana, they say try not to mix too much, even though 80% of the the population is Christian. Would you say that you stand bold in your faith in Christ when it comes to your patient care, or do you feel like you shrink back because of, what you're stating the restrictions are in the workplace?
Oh no, I do not shrink back. For the things that I believe that the Lord can do, I'm absolutely certain, and it's everything. So, just that I would not do this time. I remember a few times I've prayed with a patient, some of the cancer patient that there's no hope, or a pregnant woman that had been on a mission for too long. And I remember we had a patient with placenta previa, and she's been on a mission for so long. She's got like 4 babies already, and she came with this one with the previa, and she's also Jehovah's Witness, and she wouldn't accept blood. There's all sketchy here and there, and they usually not pray because they have their own faith, but I would go to her room every now and then and encourage her, tell her she just has to believe in God. Get your HB high, go believe and pray as much as you can, and God will make your way. Your faith is what it is.
Yeah.
God will make a way such that you will not need the blood. And God being so good, she didn't need too much blood.
But she ended up getting blood.
She ended up getting blood, which was, we had to respect her wishes and not give her blood, and she suffered for it for a while.
Yeah.
Kidneys started shutting down and all that, but eventually she pulled out of it. So praise be to God. She made it.
Yeah.
So I try as much as possible to come out. Just that, as I said, I wouldn't pray all the time to my patients unless the Spirit tells me to.
Right. And that's really all that we should be led by anyway.
Yeah. So, and of course, I wouldn't lie. Sometimes I shrink a little because it's also not. It's not. We call it unethical, and it really isn't. Because you are a doctor at work, and your religion and your beliefs are not what you're supposed to practice at work. So
interesting, because I feel like you guys have a higher percentage of Christians in your nation, but stricter rules in the workplace.
Nobody's going to cut your head off if you do that. But it's also with the training, because you've been trained for so long that you can do it. I know a lot of doctors that are pastors. In Ghana, there are so many doctors that are pastors, but you will not find them preaching to their patients at work.
Yeah,
you won't find them. No. You probably be invited to church, but you won't find them preaching. And it's not like they'll catch off your head if you do. You've just been trained for so long that you don't do that, and so it becomes part of you, and you try as much as possible to do what you can.
But God is within you, so even if you're not stating it out, God is in you as you practice as a physician.
Yeah.
So I think that it is very possible to not be bold and wild and crazy. When I say bold in terms of like loud words with your faith, but as a Christian, God is in you when you're in the workplace and when you're out of the workplace. So I think by default it flows out of you. So absolutely. Yeah, it does. So thank you very much.
Thank you
so much for sharing your wisdom, and we'll catch y'all next time on Faithful Physician.
All right, bye.